Computers and Patient Safety by Group 2, which includes Kivana Mason, Amber Tyler, and Chanel Tyson. Computers promote patient safety by improving healthcare efficiency, quality, and cost. Computers make it easier to maintain information and to eliminate error. But for computers, nurses rely heavily on their senses of touch, smell, sight, and hearing to monitor patient status and detect changes. Also, computers help promote patient safety by ensuring efficiency and minimizing error. Electronic health records, also known as EHRs, eliminates the use of paper charts and substitution for digital versions. This helps keep the data retainable for other nurses to read it, contains the patient medical history, previous diagnosis, and the medication. Computers also promote patient safety because they help focus on new approaches, diagnosis, and treatment. Computers improve communication in a way that allows more than one nurse to access patient charts at the same time, at different times, and at different locations. Computers also reduce errors and adverse events by facilitating a more rapid response after an adverse event has occurred and by tracking and providing feedback to adverse events. Computers can be very beneficial when it comes to promoting patient safety. They can do this through designating a more easily accessible way for facilities to communicate with clinicians, for facilities to communicate with one another, and by reducing medication errors, providing access to information, and increasing patient-centered care. Computers have eliminated the hassle of insurance verifications for medications, specialty physicians, and other healthcare needs. With this access, patients have a lesser chance of going in debt for healthcare costs that weren't covered under the insurance. Computers have created a gateway for the patient to communicate with their healthcare team through patient portals. These portals can be used to do various things, such as set up appointments, medication refills, and review visit summaries. Electronic health systems help to eliminate human error by tracing every step of care the patient has received. By tracing patient care, this helps clinicians pinpoint improvements and abnormalities, creates an environment for effective syndromic surveillance, and provides data for research. Computers are very essential to a nurse's daily responsibilities. Nurses use computers to chart, distribute medications, contact doctors, look up previous medical stay, and things of that nature. Any healthcare professional should make sure that they are following HIPAA laws to ensure patient safety. Using the EHR makes patient safety better because you need your own specific login information to access a patient's information. Information technology can keep track of who is going in and out of the patient's chart and keep record of everything that is happening in the chart. The healthcare team for the patient can keep track of the patient's status and work together to come up with a care plan. If all healthcare professionals use EHR correctly, we can ensure we are protecting the patient. Using electronic records instead of paper records reduce the risk of errors in charting and in patient care. Computers reduce the time of documenting, therefore leaving more time to tend to patients.